the number of cases of malignancy, it's on the rise. The same thing applies for thyroid gland also. Thyroid gland malignancy, it can be classified as differentiated type and undifferentiated type. Under the differentiated type, you have papillary carcinoma thyroid and follicular thyroid carcinoma. So the most common type of thyroid carcinoma, that is papillary thyroid carcinoma, followed by follicular thyroid carcinoma, and in this video I am going to talk about follicular thyroid carcinoma. It is usually seen in females above the age group of 40, and this itself is malignancy. It can turn into more aggressive type of malignancy, which is called as anaplastic thyroid carcinoma. Now, what are the common causes for this? It's generally believed, hypothesized, that this is common in those areas where the iodine intake is very less. And the second common reason being, if suppose the patient has been exposed for any form of radiation, like he had to take a CT scan multiple number of times, even that can predispose. And the last being gene mutation, that is called as RAS gene mutation. All these can result in follicular thyroid carcinoma. Now, the common presentation. Most of the time what happens is, the patient, they must have gone to a physician and they have got an ultrasound done, and with that report they come to us. And if we ask them, they say there is little discomfort in the anterior part of the neck. Sometimes what happens is that they know that they have a swelling here, diagnosed by one of the doctors, and that was operated, means part of the thyroid gland and the swelling removed, and that it has been reported as follicular thyroid carcinoma, and for the further management they have come to us. If this progresses, it can lead to cough, swallowing difficulty, even breathlessness, and it can metastasize to different parts of the body also. It can spread to the brain, bone, liver, kidney, and so. So on examination, there will be a small nodule may be palpable. To know for specific, we need an ultrasound scan. So this video is meant mainly for those patients who are suffering from follicular thyroid carcinoma, and they need to know what is a full treatment plan, starting from what are the causes for this, what are the tests which the doctor is going to do, are the tests all expensive, is it manageable, is it painful, the number of hospitalization, number of days of hospitalization, is it surgery or non-surgical management, if surgery, what are the preparations for that, what are the post-operative care, is the surgery the end of it, do we need more treatment after that, and if suppose is there a chance for recurrence, if so, how do you manage it, or is the life going to be smooth or not? So since you have so many questions, and to answer all this, I need to say in detail. For that, I have taken this video in 5 parts, starting from part 1. And now the second part, I'll be dealing with the necessary investigation. Third one will be about surgery. Fourth one will be surgical. After surgery, if suppose the nodule thyroid tissue is left behind, it has to be burned off or ablated with radiotherapy. And the last one, I'll be talking about the recurrence. So if you want to have the full knowledge, please go through all the 5 parts. Thank you so much.